What I would like to be able to do is hopefully share some ideas with you today so that you can go back to your services and implement some. I'd rather this actual presentation be relatively interactive, so feel free along the way to put up your hand if you have any questions to ask. So that's the end. I see.
Yeah,
and this is perfect. All right. So I thought I'd start with something a little bit different, and just to quiz you, because it's middle of the afternoon now, and how well are you really paying attention to this session? So, how does coffee consumption impact your work performance? So, A, it doesn't. It's purely a myth. B, it causes increased anxiety and emotionality. C, it increases mental processing at first, but later depresses it. D, it helps workers to focus and think faster. And E, it helps workers make more accurate decisions. Okay, so who's in camp A? It doesn't impact your performance. Any hands? Either, both. So we've got a very small number for A. B. Yes, okay, a very small number. C. Okay, a few more for C. D. And E. Well, it's funny really, because the actual answer is it helps workers to focus and think faster. And it's obviously not sustained, but that's researchers behind that recently released that it really does help people to think faster. And hopefully I'm not adding to your already, your current coffee consumption. But it was an interesting piece of data that I thought I'd share with you, although totally irrelevant from the presentation to come. So hopefully you've learned one thing new today, and hopefully you can take a little bit more. So what I would like to be able to do is share with you an approach to workforce transformation and translate that to some of the work that we've been running across Victoria and here at the Dental Hospital. So I'll start by talking about where we're currently at, where we want to be and some initiatives that we're using to get there, and also provide some examples of moving in the right direction, some small examples of success, and we'll talk to you about the overall vision. So drink up, because it will help you focus. So when I first joined Public Oral Health, which was about 2 years ago now, we ran a series of workshops across the state. And these are some verbatim statements that came out of those workshops, and a lot of you in the room contributed to those. So some of the themes were the difficulties in attracting people to our workforce, and whether that be because remuneration is relatively low or a narrow scope of practice, but some people were having some serious troubles around recruiting people to our workforce. And then actually, in terms of the actual recruitment, whether we were selecting the right people that really matched the challenges that we face in some of our agencies. So were we being robust enough in making those selection decisions? Were people staying long enough with us because they're the right fit for the sector? In addition, there were challenges around training and development. Are we reaching the right people? Are we actually having the right topics in place to be able to train and educate our workforce? Do we have the right model of care? Are we actually utilising the whole clinical team appropriately? Or are we doing this because we've always done it this way? And diversity. Some people have diverse teams, but are we really utilising the diversity within our workforce? And through those series of workshops, obviously realised the enormous challenges within the workforce area, and obviously a lot of work needs to be done and will continually to be done to be able to overcome some of these challenges. So looking at how you overcome some of these isn't simple, and it takes a long period of time to actually make real traction and real progress in some of these areas. So I'll share with you firstly some of the thinking around how you would approach this, and I wish it was more simpler than what I will share with you, but I will start with a little bit of concept and then I'll translate that to our workforce challenges. So the concept looks a little bit like this. So most of you may know this, and most of you from studying your MBAs will know that you start with a shared vision. You want something that people feel really passionate about, something that it's a common goal that people really feel a desire to be able to achieve. And then you have your environment, and obviously within the environment you've got forever changing factors, things that you constantly have to overcome to be able to deliver our services effectively. And to bridge the external gap is around having this right strategy that will really overcome the environmental factors that we face, whether they be challenges or opportunities. And then to make sure that you successfully deliver on your strategy is about building the right capabilities within your organisations. And I'll talk to you about a number of examples in that area. But of course, underpinning this is the culture of an organisation. And most people know, and I'm sure every one of you have heard the comment, culture eats strategy for breakfast, which is absolutely correct. You can have the best strategy in the world, but if you don't have the right culture, it will not be successful. So it's not simple. So there's a lot of dimensions, and it's a balance about getting all of these dimensions in the right place to be able to successfully transform your workforce. And as you'll see, when you're looking at the left-hand side, it's very much pulling on people's innate drivers. So it's having the right behavioural drivers to be able to successfully motivate people and inspire people within the workforce. And that's not easy, but we're trying. But let me translate this to what it looks like for us. So firstly, when you start with our mission, I'm sure a lot of you have learned in many presentations today, oral health for better health. The linkages between your overall health and your oral health, and having that as a vision for everybody to work towards, and understanding how we can really impact on everyone's overall general health. And communicating that in the way to people that they really understand the research behind that, and also making it very tangible for all elements of the workforce. Here at DHSV, the culture that we are trying to create is around our right values. So that is respect, integrity, teamwork, and excellence. So we've done a lot of work in this space, and we still have to do a lot of work to be able to ensure that it's actually the way we operate. It's actually the way that we do things around here. And some of the work that we have done initially, was probably a couple of years back now, we created an awareness around what our actual values are and what it really meant to people to operate in accordance with these values. And now we're using them when we're recruiting people, so we're integrating them into our practices and saying, well, we want people that display those behaviours in our workplace, because then they'll slowly be ingrained in everything that we do. And when we have to go through development processes, performance management processes, using these values to really highlight this is what the expectations are for the individuals that work within the workforce. And we've been doing some work around engagement, so making sure that people are engaged within the workplace and what we're trying to achieve. So that's a lot of the work we've been doing to create the right culture, but also I'll talk you through some more examples on future slides. So in terms of our environment, as everybody knows, we have got an increasing population, and a lot of that is an ageing population, which has huge impacts on our services and improving the oral health of our communities. Workforce attraction and retention, a constant issue with a more intensity within our rural locations. There's constant difficulties in actually having the right distribution of our workforce across the state. A continual increasing cost base, and of course the real opportunity of federal funding. That's part of our environmental opportunities that we have to date. Within the strategy across DHSV, which I'm sure a lot of you in this room may have contributed to, there are three main goals. And one is around the excellence in service delivery. So it's about the access of our service and making sure that we have the right models of care for our workforce and the right principles behind our model of care. Population oral health approach. So you heard a lot of that from Deb and Mike this morning in terms of making sure that we reduce the inequities of the population health within the state of Victoria. And leadership in oral health, which is around the research that we do and making sure it's translated into the practice, into our practice, and ensuring that we have evidence base behind what we do, whether that be care, treatment, promotion or prevention. So what I will talk to you in detail about today is around some of the capability building initiatives that we're going through here and across the state. I will talk about examples of model of care work, leadership development, and also diversity. So I'll talk to you on this slide about a few examples around what's happening in other areas. And if I'm talking too fast, please make sure you let me know so I can slow down and answer any questions. So in terms of our graduate and trainee programs, a lot of you have been involved with the VDGYP, so that's the federal initiative around the dentist graduate year, so transitioning dentists into the workforce and giving them the right support to feel confident in their future years within public oral health. And our DPGP, which is our Dental Practitioners Graduate Program, which is around training oral health therapists into our workforce and making sure that they've got the right level of support. So not only does this help people from a development perspective, but it also helps us be more attractive as an employer as people understand that they will really start to learn in a more structured way when coming to join the public sector. There has been a lot of work that has been done by Alyssa and her team in the recruitment space. So at this moment, we're very much trying to provide a service to the state so that we can support people's recruitment needs and make sure that we can support the NPA initiatives up and funding in front of us. And our next phase within that will be really helping you in building the right capabilities within your teams to actually actively recruit and select the right people for the sector for the long term. We have a mix of people that will stay with us for a long period of time, but also have the reality of knowing that there will be some turnover in some areas and accepting that. From a CPD perspective, Julie and her team have been working along and getting feedback with from lots of people and finding out what are the topics that are really going to support the delivery of our strategy and making sure that they're broader than what they have been in the past. So we focus on the clinical element, but we also have a broader component to be able to educate people on other techniques such as communicating effectively with a patient or motivational interviewing. I really need some water so I can feel that. I've got some here. And there's a number of other topics that you'll literally see released in a couple of weeks' time when the new CPD calendar is out. So one body of work that needs to be completed is around specialist capability and building specialist capability across the state of Victoria. So some of you may be called upon your expertise to be able to support the delivery of that. And of course, we want to continue many forums like this and being able to share knowledge across the state and with each other so that we can all learn from each other and continuously improve. So there's a lot of elements involved, but I want to now give you some real practical examples of some things that we're doing, and hopefully you can you can take some of these examples back to your agencies. So firstly, I'll talk about the model of care, and I'm not sure exactly if this picture here depicts it as well as it possibly could, but we've just started the progress here within the hospital in documenting our model of care and engaging people through that process and what principles we want to use and how that translates to workforce models. But that's right at the beginning stages, and I think a lot of you will know that it's a long journey to be able to get there and be effective. So it's a lot of engaging with the right people to ensure you get to the end result. So we've been doing some small things in the background to be able to support expanded scope of practice for some of our clinical teams. So we've currently run a lot of DA Cert 4 programs within the hospital and also across the state in helping dental assistants with their oral health promotion messages and also radiology. And there's been some really wonderful examples of how that's been utilised well in the workforce. I know here at the hospital, there's some positive examples around how our dental assistants have been providing health promotion messages, and perhaps it's been perceived as less intimidating coming from a dental assistant than a clinician. Some more examples about that is some work that Hanny and his team have been doing in terms of fluoride application and training dental assistants in actually administering fluoride, and that's something that we will continue with and roll out further. And in addition, the good news that hopefully I'm sharing with some of you that don't already know this, Melbourne University have an approved course now for a postgraduate certification for oral health therapists, so they will be able to extend their scope of practice and treat adults, which is literally will start running from the middle of this year. And you'll hear from DHSV in a couple of weeks because we've made sure that we've secured all of the places to be able to offer expressions of interest out to the state. So some small examples of tracking in the right direction, but realising there's still a large piece of work to be done to be able to really be able to embed this within the hospital and share the learnings across the state. But knowing that there are some pockets of innovations already across the state, I just recently came from Martin Hall's presentation within Richmond Community Health, and they're doing some wonderful work there around their model of care as well. So the next piece that I wanted to share with you is around some of our diversity initiatives. We have, at this moment, 6 dental assistants on an Aboriginal traineeship as part of Closing the Gap initiative. We have some more that will be coming on board in a few weeks' time, but what we've been able to do with this is really be offering a program that is relatively supportive. So it starts with a robust orientation, and they all have mentors and supportive supervisors to be able to help them in their learning. And after the first 3 months orientation, there's also an opportunity for them to opt out if they realise that it perhaps is not for them. And thankfully, we've been able to share those learnings across the state and provide those tools to other agencies and also some candidates. So feel free to be able to ask Alyssa and team about that if you would like some more information. But it's really the start of a journey for us, because we wanted to broaden that out much further and look at other traineeships, so perhaps within the lab, but then also moving to developing a diversity strategy whereby we really can reflect our patient base and making sure that there's a level of comfort for our patients and having a diverse workforce that's really suited to their needs. But we have a quote here from one of our current dental assistants, which is quite nice, and I think a lot of them here have been having a positive experience in learning their new roles. So this next example I'd like to share with you is a new venture, and it's around leadership development. So we've currently been going through some changes here at the hospital and making sure that we move from a work group structure to a clinical-based structure. And with that is improving our processes, our technology, and our training and development for staff so that we can move to a patient-centred model and also improve our employee satisfaction. And that hasn't come with many obstacles, because as you go through change, there's always going to be some difficulties as you implement change. And I'm happy to share some of these learnings with you at any stage, so feel free to reach out. But one of the elements of this change is making sure that we're really providing the right tools for our leaders so that they can be successful within their jobs and have the right tools to always draw upon. We spent a lot of time in looking at what are the right competencies that we really want to be able to develop with our leaders so that they can be successful and it can support the organisation in delivering on our strategy. And here you'll see a number of competencies that we have developed that we know will help us deliver on our strategy, and they are aligned to our values, the culture that we want to achieve. So within this leadership development intervention, we're starting a pilot with a number of the new roles within our Patient Connect, or the changes within the hospital that we're currently going through. So we're educating our new team leaders and managers by using this framework. And it consists of a number of learning interventions. So we're looking at face-to-face, of course. We will be giving them information and new tools. But coupled with that will be a lot of skills practice so that they can actually then talk through their learnings and actually practice on each other so that they can start to feel confident in some of the tools that they're learning. We're also developing coaching for each of these leaders so that they have what we call coaching pods and people can start learning from each other and creating learning networks. The program itself will be about a 6-month period, and so literally every month there's 2 interventions to be able to really support leaders on their journey. There's a lot of evaluation that we'll do post this program, and then we'd like to be able to share that with you so that you can actually understand what leadership development interventions have worked for us, and hopefully you can also copy those within your agencies. So as I mentioned before, going through change projects are not necessarily always as smooth as possible, and I can say that we have had some kangaroos that have wandered in our path, but we've been able to always think of new ways to be able to overcome these obstacles and not continually trying the same ideas, but trying new ideas to be able to solve our problems.